Welcome back, everyone. A few weeks ago, we told you about an increase in overdose deaths in Columbia and other mid-Missouri areas. But tracking this data has been a challenge for officials. In this Target 8 investigation, KMU8's Rachel Henderson takes a look at what factors are contributing to that challenge.
Looking at the numbers to find out what's going on helps us to create a map for how to resolve some of these issues and make those numbers go down a lot farther.
Heather Harlan works for the Columbia-Boone County Health Department, but in her spare time, she volunteers on the Boone County Overdose Response Coalition.
Show people what comes in a kit.
She's one of the main people helping spearhead efforts to collect comprehensive data on overdoses in Boone County.
Well, in 2019, there wasn't even a code for an overdose dispatch. And our local first responders decided, this is happening a lot more often. We need a code for this. We need to start collecting numbers.
But this is not a solo effort. The coalition relies on data from the Columbia Police Department, the Boone County Sheriff's Department, and the Medical Examiner's Office. Harlan says the most important figures are the number of dispatches involving a suspected overdose, officer reports taken for probable overdoses, and deaths the medical examiner rules as caused by drug overdoses. Based on the data she compiled, the number of suspected overdose dispatches from 2020 to October 2022 decreased. In 2020, there were 402 suspected overdoses, 378 in 2021, and 314 in the first 10 months of this year. But the number of deaths increased for this same period. The medical examiner confirmed 18 overdose deaths in 2020, 30 in 2021, and 25 as of October of this year. Harlan says the struggle comes when considering factors that are difficult to track at the scene of an overdose.
We don't know how often that's happening, and sometimes people are revived with an naloxone, and so we don't know the outcome of that. If they didn't go to the hospital, then it doesn't get counted as an overdose response.
In the past year, the Overdose Coalition distributed about 400 two-pack boxes of Narcan, which helps to temporarily revive someone experiencing an overdose. One community center in Jefferson City, on the other hand, has taken distribution into its own hands.
I saw it was a need in the community, man.
Doug Wright started building community bridges. That's a Jefferson City center that provides resources and services to residents. But before that, he was a heroin addict and dealer.
For me to be able to gather this information and acquire the things that I have acquired through my experience and have this information, I just want to give it to the next person because they may be walking around trapped like I was.
Wright makes his own harm reduction kits, which include packs of Narcan and informational pamphlets that he gives out for free each week.
Just need to meet the people where they at.
But Harlan says one of the biggest challenges is to make other people care.
One of the things that we find, of course, is that because there's so much bias and misunderstanding and stigma around substance use issues, that people lose their community.
Which is why she says having the data now is more important than ever.
The numbers don't just present themselves. So if you want a map of how to make a situation better, you have to have people collecting, sharing, and analyzing the data.
Rachel Henderson, KMU8 News, Columbia.
Now, we reached out to the Columbia Police Department on multiple occasions to hear from them on how they keep track of their overdose data, but we didn't get a response. But both Harlan and Wright agreed that from their experience, numbers aside, the most important thing is saving lives.